So this actually is a 56-year-old female who presented to this particular urgent care or emergency department in Tawam. And what happened is she had a presentation of 48 hours of symptoms. She presented with some heaviness of the tongue. She complained of some left-sided numbness and some sensory changes. There was a bit of facial asymmetry, and she complained of some visual disturbances in the left eye. So we used the LEO360 AI robot to connect the patient to the neurologist in the comprehensive stroke center remotely. And this is a patient with a little bit of a language barrier. She had arrived from India recently, and she had reported this onset of neurological symptoms. And there was a strong family history of cerebrovascular disease. And she was not taking any medications at all. So what we were able to do, the neurologist was able to examine the patient and make a diagnosis on this case and actually proceed with further management plan. They connected, they were able to visualize it. They thought the patient probably had a TIA or an ischemic stroke, but the patient was beyond the thrombolysis window because the patient presented at 48 hours. So what they decided was better to investigate this patient with an MRI. So they decided to transfer this patient across to our comprehensive stroke center for further MRI and admission and then further workup in this case. And these things happen very seamlessly and very quickly so that the decision could be made. And in fact, I don't know whether Kevin is maybe going to show a video. We actually asked one of the patients' relative, what did they think about this whole process of using this Leo and what did they feel? And they were actually thrilled, and to be honest, they were actually ecstatic because they thought, you know what, this is a novel device, and they could see, and even the family members could interact with the neurologist and clarify their doubts and questions that they had while the neurologist was interacting with the patients. And if there were any doubts or queries, they could clear it with the neurologist face to face in a timely fashion, which may not even happen when you put out a call. And if a neurologist has to come from home, for example, that might take 20 minutes or 30 minutes, whereas this was happening within a few minutes of a phone call from the robot connecting with the neurologist remotely.